If it wasn't for the media, there'd be simply no scrutiny on the Victorian government because, unlike everywhere else, the state parliament is shut down as hard as the economy. The whole of Melbourne is under curfew, subject to what amounts to near martial law, given the state of emergency powers ran through the parliament, as I said last week. Today, extraordinary revelations about the true state of Victoria's contact tracing system, the failures to date, the offers of help that have been rejected, the people in charge who are really just not across what's going on, but should be. Tonight I want to expose some of the insider games being played, some of the most cunning stuff I've seen in a long time. I'll show you what's been revealed out of a couple of interviews today that expose the sheer spin we're getting day in, day out from Daniel Andrews. If you listen to the Premier, he says criticism of Victoria's contact tracing scheme is out of line, that Victoria's right up there with the national guideline standards. Only the PM says it's not. So too do the experts. Here's Professor Peter Collignon, expert epidemiologist, on Victoria's contact tracing last night.
You might achieve in the short term, but it's not sustainable in my view over the medium term. You've got to actually have a vaccine that's 90% effective if you really want to sustain it for a respiratory virus.
And this report too from Channel 9 exposing the huge gap between how good the New South Wales system is and how far behind Victoria is.
The state government has refused to say exactly how many are on the phones. 9 News understands that number to be above 150, with almost 12,000 positive cases in the last month. New South Wales has double the amount of traces for around 400 cases.
Now, inexplicably, as far as I can work out, that report from about 3 weeks back never actually aired on Channel 9 in Melbourne, where segments of the media, I have to say, have been way too soft on the Andrews government for way too long. But not today. Neil Mitchell, the veteran 3AW radio host, is one of the country's best interviewers. And today, he didn't miss. He interviewed Greg Hunt, the Federal Health Minister, one of the most accomplished performers, always on top of his brief. Mitchell wanted to know if New South Wales is the gold standard, we're all told by the experts it is, when it comes to contact tracing. If it is, how does Victoria need to improve?
What is New South Wales doing differently? Is it just a function of the numbers? They haven't had the numbers that we have.
No, New South Wales has had half a dozen outbreaks that are all the equivalent of the hotel quarantine breach. These are overwhelmingly cases that have come from Victoria, that have transported across the border, unknown, seeded into the community, whether it's Thai Rock, whether it's Crossroads or other cases, and then they've chased them down. And that's the difference. They've been able to recognise, get on top early, chase them down, trace them, identify...
But why can't we? What are we lacking that we want to do that? What are we lacking that we can't do it?
Well, there's a story on the front of the Age which I actually welcome, and that is that...
the new computers,
that Victoria will now move to an automated system. And
but this was offered in March.
Now let's stop there. It's taken me to finally hear that today, that Victoria doesn't yet have an automated, fully integrated contact tracing system, and that such a system was offered to Victoria back in March, so 7 months ago, and clearly it hasn't been taken up. Along with the Defence Force help too, well, that was rejected months ago, as we know, which all explains, doesn't it, why Melburnians have been locked up for much of the year, why businesses are going to the wall, why families are getting their first calls from the contact tracing teams after their loved ones have died from the virus and been buried. But it wasn't as if the federal government hadn't tried to help, sending in the chief scientist of Australia, Professor Ian Finkel, no less, to advise the Andrews government on what they needed to get their system up to scratch. Here's Neil Mitchell again.
It'd be fair to say Alan Finkel was concerned or surprised by what he found. He's a well-respected man, independent scientist, as you say, Australia's chief scientist. Was he concerned or worried about what he found?
Look, Alan's too professional to be expressing emotions. He's just focused on, here's a problem and here's how I fix it.
But were you concerned about what he found?
Well, the reason we wanted the ADF in, and the reason we wanted the Chief Scientist of Australia in is precisely because we were concerned that there was a significant number of cases that hadn't been contacted and hadn't been traced.
Well, do you know why the Victorian government didn't accept the suggestion of this computer tracing system back in March?
Look, I'll leave that for them to answer.
Okay.
Now, this is where it all gets really interesting. After Greg Hunt, Mitchell interviewed Victoria's Chief Health Officer, Professor Brett Sutton. Now, I suspect Sutton hadn't heard the Hunt interview. Maybe that's why there's an ad out today for a new media advisor for Sutton. Of course, that advisor is going to be paid $200,000 a year. Maybe that's why, too, that Brett Sutton was a rare no-show at the Premier's Daily Talkfest. Because after Sutton told Mitchell that all was well with Victoria's contact tracing system, which of course isn't true, and that all the Finkel recommendations had been adopted, Sutton made this unbelievable admission.
Yeah, look, he hasn't spoken to me directly. He's spoken to those who are oversighting the improvements to all of the technological aspects with our data team and Chief Information Officer. I can come back to you on that. I'm very happy to speak to all of the things.
So you haven't seen a report from him?
No, I haven't.
So the Chief Health Officer, that's right, has not actually spoken to the Chief Scientist, nor has he actually read his report. Yet this is the report that provided the blueprint to fix Victoria's contact tracing mess. Is it any wonder we got this bombshell from the Premier a little later on this morning?
The Chief Scientist, the ADF and some very senior officials from the Department of Health and Human Services will later this week be travelling to Sydney, and they will again just double and triple check whether there is anything that is different between our response and the response in New South Wales.
But it gets worse. Not only should the Premier have sent his people to New South Wales months ago to learn from the best, but this admission today again from Brett Sutton that his system, when Daniel Andrews gloats about the modelling from supercomputers, still runs in part on paper and fax machines.
Did we stop using fax machines and phone calls?
Oh, God. As soon as possible, but, you know, part of the...
Well, they're still being used.
They are, because they're still in GP practices where that GP practice software doesn't link. And, of course, you've got to link every single practice and every one of those, you know, dozen or more versions of practice software into a system that allows for direct notification. So the labs are doing electronic notification, and we've progressed that to, you know, the majority of lab notifications just in the last 12 months. But from primary care, it's a bit of a beast.
I mean, paper and fax machines, is it any wonder Victoria is in the strife it's in? But as shocking as all of this was, the worst was yet to come. All along in this pandemic, everyone in government, particularly though the Victorian Premier, has insisted that they're following the expert health advice. It's all about the health experts, nothing else, no common sense, no economic modelling, no proper consultations with business. It's all about the health advice. Well, listen to this.
Has the government ever introduced something without your advice or against your advice?
No, not against my advice. You know, the curfew came in as part of the state of disaster, for example. It wasn't a state of emergency requirement. So, you know, that was something that was introduced, but it wasn't something that I was against from a public health perspective.
But were you consulted on it or not?
Yeah, I was consulted on it, but it was a separate decision-making pathway.
So Victoria's curfew, the most draconian restriction of all, a curfew, I might add, we never had in wartime, was not a decision based on health advice. In fact, it was a complete surprise to the Chief Health Officer, Brett Sutton.
Would you have introduced it?
In public health directions? I'm not sure. I haven't reflected on it.
Now, sure, in the interview, he tries to mop up once he's realised he said more than he probably should, saying, oh, look, I'm not against it. But what's crystal clear is that Victoria's curfew was not put in place on health advice. And if not health-driven, well, clearly it was political. And that's the real problem now in Victoria. What's happening now is that almost nothing happening to Victorians, to families, to business, to mental health, the whole gamut. None of it's got anything to do with health anymore. It's entirely driven by the politics. The politics, and of course the megalomania of one man.